we have a lot of questions here, ladies, dear colleagues. So I will start addressing the questions for each one of you. And I think we have maybe short time for the amount of questions that we've received. But let's start with this question here with Dr. Bedoya from Brazil. We have more than 1,000 connections for this webinar. So Dr. Sebastian Garçon, thanks for being so visionary and letting us present these techniques. Before we start with the questions, because I'm the plastic surgeon in the chair, I just want to say that these phenomenal tools to come together with the plastic surgery. They are not substitute, and we have some certain boundaries where we for sure go for lipo injection, and for sure surgery is our option. However, some situations we face in our day by day that surgery is not an option. I would say at least 3 of them. Amount of fat, for example, those patients that had no fat available for augmentation. I can say that they don't want downtime is the second point that lead us to this non-invasive procedures. And the third one is skin quality issues that we barely can improve with surgery. So that's why even being a plastic surgeon, I'm really enthusiastic with this by chairing this table and by introducing these 3 phenomenal tools given by 3 experts in each area for you. So Dr. Juliana, I think the first question goes for you. When a patient is, and it's from a colleague from Brazil, and she's asking, when a patient has needs the 3 approaches to be in her buttock, where to start, how to start, is from Dr. Stefania, a Brazilian colleague.
Okay, so let's think about it. The patient needs the 3 approaches. I think it's better to analyze this patient and to decide what this patient needs. In my experience, when we have such a huge laxity, it's better to treat the laxity first. So that's, I say, when we do polylactic acid, we put the house in place. It's like that. You have to treat all the region to do a global treatment. And for me, in my experience, I start when there is such a huge laxity, I start with PLLA. I inject PLLA depending on the patient goal, but to treat all the laxity. And then I use hyaluronic acid to do, how can I say, to do a wow effect and give the patient a good result. I like so much to use both techniques to give the patient the best result.
Thanks, and this leads to the other question, Dr. Luciana. When to combine, can we combine polylactic and hyaluronic in the same session and in the same area? This question goes for you, Dr. Luciana.
Okay, there is still no consensus on this, but I believe that in the same place, I do not recommend the association because in general, we massage a lot after biostimulator. And after the filler, we cannot massage. But in different areas, I do not see a problem, the association. But in the same area, I prefer to treat first with biostimulator, first polylactic acid, and after hyaluronic acid. In my opinion, it's better to treat the sag skin and after improve the size, improve the contour.
Perfect.
Ale,
Yes, Ju. Yes, Dr. Sarupi.
I think now I understand what the doctor asked me
Mm,
regarding Fermanagh technique.
yes,
He asked me when the patient needs the 3 approaches in the Fermanagh technique, right? That's it?
that's it.
Okay. So when the patient needs the 3 approaches, you have to see which is the issue that most bothers her. And in our assessment, we can see and we can decide if it's better to treat first the laxity that we say it's like skin quality, or if she needs volume and projection, and or if she needs some lifting effect. But like I said, when there is so much laxity, I start treating so 50% in the frame and 50% in the target. Okay?
I agree with you. I agree with you, Juliana.
Start with the laxity first, then fix the laxity, and then use hyaluronic acid in some spot areas to increase the outcome. Dr.
But the muscle are very important too. I think that it's important to treat first the muscle. The muscle is very important to buttock. And I think that it's interesting to think about the muscle.
That's a very good point, Dr. Lorenzo. So you think starting with those devices that are muscle tone enhancers are a good thing to do, starting with them and then fixing the muscle first and then going for the laxity and the third for the volume. Is it?
Yes, yes, perfect.
Dr. Fogassa, there are 2 questions for you, please. First of all, if you do use monothreads or screw, how long are the threads? And the other question that comes from Curaçao, these 2 questions comes from Dr. Raiza from Curaçao. And then there's another question from Ecuador. How long the treatment lasts, and the threads on Botox from Dr. Serrano from Spain. So we have a question from Spain, from Dr. Serrano, how long the threads last on Botox. Another one from Curaçao about the size and the if you use mono or screw from Curaçao. And then we have another question from Ecuador also. Sorry to give you the 3 questions, but they are all addressed for you. If the treatments are done in one single session with all the threads.
Perfect. This is a good questions. First, I use mono threads, but we can use screw threads as well. And it will be totally absorbable around 8 months, but the results lasts around 18 months, exactly like the histological studies show us. Exactly this. I think I'm okay with 3 questions.
Yes,
Or I
it's
forgot.
just if you do only one session with all the threads that you plan, or if when you divide in sessions and why you divide in sessions.
Okay, perfect. I usually do one session, and it lasts a year in general. and just with threads, without devices or other biostimulations.
And they are asking if the threads are available in Chile. Are they?
Yeah. In July, I do the launching with exactly these threads in Chile.
Perfect. So hello from Montreal, Dr. Elise for Dr. Sarubi. She's asking how many times do you repeat the treatment with Sculptra? I think she's asking about the number of sessions and also about the maintenance after this.
Okay, so I used to do Sculptra in 3 sessions, the first treatment, and then the maintenance treatment once a year. But now I realize that many patients, as us, need and want to see fast results. So nowadays I used to do the Sculptra treatment in 2 sessions, and then one session per year as a maintenance treatment.
And how is the maximum of vials that you use per session? Is there a maximum?
It depends on the budget, right? But what I see in my experience, using this technique, using Firmenich, I do have so good results, so satisfactory results, using in a total of 8 vials, especially when we want to give volume to the buttocks. When we want to treat skin quality, many times 4 vials work very well. But I think it depends on the patient. It depends on the degree of laxity. It depends on what the patient needs, right?
Right, but even though I observed that this technique use less product than we use in the very beginning, that the techniques described were using like 20 vials, or even though I think we have an improvement in outcomes and a reduction of the total number of vials. Is it not, Dr. Sarubi?
Yes, exactly. When we start to do this, when you see in the literature, many papers, I will say all the papers in gluteal area, they inject PLLA in a homogeneous way in all the region. And when we inject specific areas, specific amount of product, we can improve our results. And the papers that exist, they inject 22 vials in total. And with this technique, we can inject, we can have very good results with 8 vials. So we can do more with less.
Thank you. And this is how the knowledge of anatomy improved, and the knowledge of anatomy and also, the time of use with the product improves the outcomes. And Dr. Lorenzo, now we have a question for you from Dr. Noah Sayed from Egypt. The first part of the question is concerning if the large volume will affect the vascularity of the area. And then the second part of his question is it better to inject a small amount of fat that could be possible to guarantee the good take than injecting large in volumes? So and the other question is about the final volume.
It's a wonderful question. It's a very nice question, because with hyaluronic acid, it's the same. It's the same. I advise you to respect 20 ml per session to guarantee vascular integrity. is very, very important. I can't to put a lot of volume in subcutaneous tissue in one session because it's not so good to subcutaneous tissue. It's very important to guarantee the anatomy, the vascularity. It's very important to put small quantities of product per session.
And Dr. Lorenzo, how long does the result last with hyaluronic acid? And also they are asking if there is a specific brand that you recommend as being safe or as according to your experience. So this is a question from Dr. Carrasco from Chile.
Okay, in my experience, it's good to repeat the treatment once a year because the patient's good, the good result, but after 1 year, I have hyaluronic acid in subcutaneous tissue. But my patients are good it's good for us, for you to repeat it once a year.
And which are the post-procedure precautions that you advise your patients? This is a question from Dr. Kumar from Canada.
Okay. I advise 2 days only without exercises only, and azithromycin for 3 days, 500 per day. It's very important for the patient, and analgesic if necessary, only.
And concerning exercises, how long do you
3
recommend?
days, 2 or 3 days only.
Okay. And one question for three of you. We can start by Dr. Lorenzo, then Dr. Sarub and Dr. Fogassa. The combination with devices, is it before, after, is it possible, recommendable? So can you, three of you, please?
The combine, what the product is good to combine or
Yes.
not, technologies.
Yes, with technologies. Can we use technologies? If it's good to use before or after, and which
Okay.
are recommendations?
For me, it's very interesting to treat the muscle first with electromagnetic waves. I like this, to treat the muscle first. And after, the skin quality is very important. And the last, it's hyaluronic acid. I like this. And the cellulite, it's good to treat the cellulite first too, in my opinion. And the hyaluronic acid is the last one.
Is the cherry on the top of the cake?
In my opinion, but I would like to the Juliana's opinion. Okay, what do you think, Juliana?
I totally agree with you, Lu. I
Okay.
think hyaluronic acid is at the top, like a refinement. You have
Okay.
to treat the whole structure first, the skin quality, and then you give the wow effect with hyaluronic acid. And I like to associate with technologies. When I associate technologies, I usually do these treatments within 3 days of interval between each of them.
Okay. And Dr. Carrasco, you asked me about the brand. My study, I published a study. I used the Softderm Subskin. And Softderm Subskin is possible to do. You have in Chile. Softderm Subskin.
Dr. Fogassa, about the threads and the technology, how do you recommend the combination?
Perfect. About threads, the ideal is to use laser and technologies before the threads.
Okay. There are few other questions concerning the threads. Do you mind? first of all is, please doctor, the G and the length of the thread, is it cog? Is from Dr. Jedi from UK.
Can you repeat, Lee?
I guess the G and the length of the thread, I guess, is it cog? This is the, I think they want the reference of how many zeros and the length of the thread that you're using.
Okay. I use mono threads, not cog threads, with 0.0 USP, United States Pharmacopy. This is the thickest thread that we have, maybe. The
And,
ideal for body treatments.
And how is the maximum? This is another question from Dr. Galina from United States. How many threads is the maximum that you use per session?
There aren't. I usually use totally 40 threads to treat these buttocks with the results.
And then there's a question from Albania, also for you, Dr. Fogassa. How do you plan the thread insertion? One thread group per quadrant? How is the planning?
Okay, I use 5 PDO threads for block with 4 blocks in fan technique. In total 20 threads with 21 gauge per side.
And Dr. Lorenzo, there's another question from, I'm glad to see the number of questions that we are receiving for this webinar, considering that we are in December 21st, is the middle of the day, and this is a very, very non-surgical session. So I'm thrilled to see the number of questions and from the whole parts of the world that still are coming here and pumping in my screen. So the next one is from United States, from Dr. Elena Casahova, for Dr. Lorenzo. Amount of AJ per session, please.
Amount of?
Maximum amount of AJ per session.
Okay, yes. I recommend 20 ml per session because it's necessary to respect the anatomy, the fat anatomy, the vascularity, and it's very important to respect this. And I recommend, in my study, I used 20 ml per session only. And it's possible to see results with 20 ml per session. If you necessary to repeat the session, it's good to respect 15 days.
Perfect. There's another question. Is one technique safer than the other? And then I guess Dr. Alex Poirier from Canada, thank you for your question. But I will allow myself to answer this question. I think we are with very expert dermatologists, and all the presentations, they focus not only on technique but also in anatomy. So they presented the best practices in each of the techniques. So I think there's no one safer than the other, because they are all based in experience, anatomy, and indications. So I guess we are around 3 safe techniques if they are based in this 3 pillars: anatomy, assessment, and expertise. So I want to see if there's any other question from Inca's team, please. because we are close to the time that we have to start our finishing. Okay, so dear colleagues, I want to thank you from the bottom of my heart by your participation. This was for sure a very high-level webinar to end INCA's Academy year. So this was the last webinar of INCA's, and I guess we ended in such a high level that INCA's must be proud of the Brazilian work on buttocks, and also by inviting us to end up this year of 2022. So I want to thank you, each one of you that stopped the day to be with us, and the ones that are still going to watch this webinar. Invite you all for the first webinar that will happen after the first 15 days of January, and also for sure to invite you for our live Congress in Paris in the end of January. So thank you, Luciana, Juliana, and Andrea. I want to encourage you all to follow the Instagram of the 3 dermatologists, because they all give lectures, courses, and trainings hands-on in their practices. So if you're more interested in going deep into the subjects that are completely available with their Instagrams and the social media, I just want a final word from each one of you, a final word of goodbye for the attendees and also for INCA's. And thank you so much for being here with me today. Dr. Lu?
It
Thank
was a
you.
pleasure for me to be here with you and with all physicians here. Thank you for attending us.
Yes, thank you. It was such an honor. Thank you, Ale. Thank you, INCA's. Thank you, Lu and Andrea.
Thank you. It was a pleasure to me, and see you in Paris.
See you in Paris. See you in Paris.
See you. See you.
Very Merry Christmas, and have a very healthy and happy New Year. Thank you, Dr. Garçon. This was an amazing time for us. Thank you for trusting in our work and for letting us share our experiences with INCA's. Goodbye, everybody. Goodbye, INCA's team. And thank you, Laura, for the nice organization of this webinar as well.